So a little bit about me. I'm 16 years old, the middle child of three, like my mom said earlier, and I have been diagnosed with ADHD since I was 10 years old. I'm a Boy Scout, a swimmer, and I'm the co-host of a podcast that I created called Twice Exceptional, Teens Exploring and Living with Neurodiversity. So neurodiversity is the idea that things such as ADHD and autism should not be classified as disorders or deficits, but rather just normal differences in the brain. So as I said earlier, I was diagnosed with ADHD at 10 years old. I was actually diagnosed after my younger brother. He was brought in first for a diagnosis. And so after that, when they were filling out like a form they had to fill out, they were going through it, and a lot of the symptoms and stuff I also showed. So then I was brought in and diagnosed after him. And it was kind of a weird time for me because like I hadn't really been expecting to have ADHD because I never really thought about it that much. During the testing process though, they basically did a lot of different stuff. There was like a form I had to fill out, and then you like sat in a room and they had like a screen and you had to like click the button when a certain letter popped up. And there was just someone watching you, and I kept moving around, so that might have been part of the reason why I got diagnosed with ADHD. And then, so yeah, I did the test, and then it was also kind of weird because I'd been diagnosed or tested for giftedness when I was younger, so I'd already had that, and I'd had pretty good grades throughout school, and never really had any issues with that, so it was kind of weird for me to think that I had something that most people would classify as like a disorder. But then I looked back and realized that I actually did show a lot of those symptoms because I could never sit still, especially when I was younger, and I would zone out during class quite often. So before I get into ADHD and orthodontics, I'm going to discuss ADHD in general to provide you with a better understanding of the condition and for you to use in your daily interactions. So ADHD stands for Attention Deficit Hyperactivity Disorder. The common symptoms are impulsivity, hyperactivity, and inattention. There's a stereotype for ADHD that's usually a young boy with a lot of energy, but this is not necessarily true, as ADHD can show itself in many ways. For example, me and my brother both have ADHD, but we're very different people, and it's been a very different experience for both of us. Also, I just want to explain that there was ADD versus ADHD. Right now in the United States, it's just classified as ADHD, but there used to be ADD also, so both forms are under the same name at the moment in the United States. And then here's some statistics. So 6.1 million children have been diagnosed with ADHD in the United States. That's about 10% of all children in the United States. There's also a 3-to-1 ratio of boys to girls with ADHD, but part of this may be due to them being less likely to be taken into getting diagnosed, because usually when they are taken in, it's because they had difficulties in school and a teacher suggested to them, hey, you might want to check out ADHD as an option, and I feel like that doesn't happen quite as often for girls, so that may be part of the reason for the inequality ratio there. And then additionally, 2/3 of people with ADHD have a co-occurring condition. So what are some of these co-occurring conditions? Well, 45% of kids with ADHD have a learning disability, and 27% have a conduct disorder. 18% of children with ADHD have anxiety, 15% have depression, and 12% have speech problems. Personally, I have had to deal with anxiety the most. Out of those, I haven't had to deal with any of the other ones that extremely, but I do get extremely anxious about small things quite often, and it has interfered with my swimming some, but I've gotten better at it, especially in the swimming. Now it's mostly just for school type of things. So these co-occurring conditions can bring about an extra level of difficulty when you're having these people as your patients. So before I get into that though, I am going to discuss the medications that are taken for ADHD. So when it comes to ADHD, there are medications that are recommended along with coaching or therapy to help the child actually learn how to control it. So there are two main forms of ADHD medications. There's stimulant medications, such as the ones that I take. These are very fast-acting and commonly prescribed medications. They do wear off throughout the day though, although some people also do take boosters in the afternoon to make it last longer. So non-stimulants are an alternative to stimulant medications. They were approved for ADHD treatment in 2003, and they build up in your system a lot longer, so they can also last up to like 24 hours. But initially, these medications may take a few weeks still not as commonly prescribed. So when looking through patients' like medical history and stuff, it's important to know that if they have ADHD, some of these medications might be on the list of things they take. So some common stimulant brands include Adderall and Adderall XR, Dexedrine, Vyvanse, Concerta, and Ritalin. And then some common non-stimulants include Strattera, Intuniv, and Palpine. There are many potential side effects that come with these ADHD medications. Some of these include dry mouth, addiction, insomnia, diet changes, and irritability when the medication wears off. For me, the diet changes has been the biggest struggle because when the medication is most active, which is usually around lunchtime for when I'm eating, that's when I generally have a very hard time eating a lot of food. And it's a big deal for me because as an athlete, I need to be eating a lot of food in order to get the most out of my workouts. So what I've had to do is I just eat more for breakfast and dinner to help counteract this. And then also I spread out when I eat my lunch food more. That way I can try to make myself eat more so that way I can still continue doing the athletic activities that I do. With Patrick also, he's had difficulties with the insomnia part of that. So especially on the past medication we took, there's been difficulties with going to sleep and staying asleep with the medications that have also affected us. But now that I've provided some context on ADHD, I'm going to focus more specifically on orthodontics. When it comes to the orthodontic office, there can be many difficulties for an ADHD child. So one of the biggest struggles can be sitting still for long periods of time. It can be very difficult to not move during treatment or while being examined. And then the other major difficulty is the hypersensitivity. People with ADHD tend to be sensitive to many things, including loud noises, weird textures, and bright lights, many of which are present in the orthodontic office with all the different tools and like the lights above them when they're getting the treatment. And then another important thing to note is that children with ADHD tend to experience time blindness. So time blindness is the concept where kids with ADHD have no sense of time. So the passage of time does not work quite the same for us, and so we don't know the difference between short-term periods and long-term periods of time. So for example, like we can't really tell when things are becoming like long-term goals, so we need something like now. If it's not happening now, then we don't really understand that it's happening at all. And that's also why we tend to be super forgetful about things, because our short-term memory can hold less information than a neurotypical person. Neurotypical people are people that do not have like ADHD, autism, or dyslexia. Those people are classified as neurodivergent. And then instant rewards is one way to counteract the timing issues, but I will go more in depth in this later when I'm talking about the tips to help you in the office. So not every part of ADHD is a bad thing. In fact, hyperfocus, or our ability to obsess over a new topic and learn skills quickly, can be very helpful even in the orthodontic office. Because if we become interested in the process, we can hyperfixate on it and become better at maintaining hygiene, brushing our teeth, and wearing our elastics. Hyperfocus does tend to wear off though, so reminders are still extremely important through the process. So now I would like to share some tips to help you when you're treating kids with ADHD and to make the process a lot easier. So in the office, there are a few changes that you might want to consider making. Explain the process of the treatment to an ADHD child would give them the opportunity to hyperfixate on it. So some ways to do this is to show them the different scans of their teeth and how their teeth will be moving, particularly when you're talking to those who are super interested in technology, because a lot of kids with ADHD have become hyperfixated on technology at some point and are really interested in learning about the different process. And this also helps with the hypersensitivity, because if they're aware of what you are doing, then it'll make it a lot easier for them to like be aware of when the different weird textures and sounds will be on their way. And then another thing that should be done is offering validation for good behavior. Since many ADHD children tend to have low self-esteem, so this verification helps them make sure that they do the right thing. And then also it makes the child more likely to continue doing the things like wearing the rubber bands or elastics and maintaining their good hygiene and brushing their teeth and all of that. And then finally, you need to take breaks during long appointments. This may seem like it might take a little more time, but in the end it might save you time because that means the kid is less likely to move when you're actually treating them, especially if you have a really long appointment and a kid who will not sit still. You do need to take those breaks to help to make sure that they do sit still when it actually matters the most. So outside of the office, there are many tips that parents should use or guardians should use to help make the process a lot easier for the orthodontist so you can share some of these tips with other people. So scheduling appointments in the morning is generally best because kids that do take ADHD medications, that's when the medications are going to be the most active. So it'll be the easiest for them to sit still and behave in the mornings and not in the afternoons or later in the day when the medication is wearing off. And then we have the instant reward system. So basically, since we have no sense of how long things last, we need something right now to tell us like we should be doing this because we're getting a reward right now. Because if you tell a kid with ADHD that like if they don't wear their rubber bands, it'll increase their appointment time by like 6 months or whatever, they won't really understand that because time doesn't really make sense to them in that way. So you need to come up with another solution to get them to do the things. And offering instant rewards for doing things such as like brushing their teeth or wearing their elastics or rubber bands or aligners, those will help them actually do the things more. For example, in our house, Patrick, he has this with his homework. So basically what they do is he gets points if he does things like turn in his homework on time and stuff like that. And then he can exchange these points for other things such as like eating ice cream or playing video games and stuff such as that. And then finally, reminders and checklists are very important because we tend to be very forgetful, like I said earlier. The important thing about this is to put the reminders and checklists in places that you will be able to see, because if you cannot see it, you will generally forget it. So you need to put like reminders in like sticky notes over your room. If you check your phone often, then put them in your phone. If you have a planner, you can use that too, but usually kids with planners, if they have ADHD, they have a harder time checking their planner unless they're already in a habit of doing it. So generally, you just want to put it somewhere you know they're going to be looking. And then also that works for appointments and things such as like brushing your teeth or wearing your elastics. The most important part though is education. So making sure that you and the people in the office know about the different parts of ADHD, so that way you know the best way to treat them and act when you meet people with ADHD, because a lot of children do have ADHD, whether or not you will know it at the time. And so educating yourself and being patient with the kids with ADHD, even if they keep moving around or they're reacting badly to the loud noise, those things can help a lot because that will remind them that it's okay and that they should be doing this. And then if you help counteract some of their symptoms that they might have, it might make the process a lot easier for you. So thank you.